Hello, welcome to MUSC and the Shawn Jenkins Children's Hospital. My name is Eric Graham and I'm the Division Chief for Pediatric Cardiology. As the only pediatric cardiac surgical and interventional program in South Carolina, we offer comprehensive inpatient and outpatient care to all children living in South Carolina and the surrounding regions. This statewide model provides us with high clinical volumes and has resulted in unparalleled program stability. We are proud to be regarded as one of the premier pediatric and congenital heart programs in the country because of our long-standing history of exceptional clinical outcomes and innovative research. A few of our accolades include being recognized as a top 10 program by U.S. News and World Report, designation as a 3-star program denoting the highest category of quality by the Society of Thoracic Surgeons for 5 consecutive years, and we were one of 9 core centers in the Pediatric Heart Network and one of only 5 centers that have been a core center since its inception in 2001. What I am most proud of, though, is the team that makes these accomplishments possible. Our team is comprised of people who are brilliant, talented, altruistic, collegial, and kind. This results in an amazing culture where this level of success can be sustained and you can reach your full potential. Thank you for your interest in MUSC, and I look forward to meeting you.
Hello, my name is Yar Chaudhry. I'm the Associate Director of the Pediatric Cardiology Fellowship Program. I'm an attending in the Echo Lab, and I'm an advanced imaging cardiologist.
Hi, I'm Sine Zablewski, and I'm the Program Director of the MUSC Pediatric Cardiology Fellowship, as well as an attending in the Cardiac Intensive Care Unit and the Echocardiography Lab. Over the next several minutes, we'll be providing you with an introductory tour to the Heart Center at the MUSC Shawn Jenkins Children's Hospital. And we hope that through this virtual tour, we are able to convey to you the outstanding qualities of our training environment as well as our programmatic culture. Thank you again for your interest in MUSC, and we look forward to meeting you soon. Welcome to the Heart Center at MUSC Shawn Jenkins Children's Hospital. We will start today's tour in the cardiac ICU and step-down unit. This is a brand new state-of-the-art unit that includes 11 step-down beds, 14 ICU beds, and 4 flex beds for a total capacity of 29 patients. Our program has 3 exceptional congenital heart surgeons with expertise in both pediatric and adult congenital heart surgery. Our surgical volume is over 400 cases per year and includes the entire breadth of congenital cardiology, including complex neonates, mechanical support including ventricular assist devices, heart transplantation, and adult congenital cases. The units are staffed by a team of cardiac intensivists, cardiologists, outstanding bedside nurses, and numerous multidisciplinary staff. The learning environment is immersive, experiential, and collegial. While working in the CICU and step-down unit, the fellows rapidly build a solid foundation in complex cardiac anatomy, physiology, cardiac surgery, and acute care.
The MUSC Pediatric Echocardiography Lab is located steps away from both the CICU, step-down unit, and operating room and interventional suites. Our lab performs over 11,000 echocardiograms annually. Fellows learn to perform and interpret transthoracic echocardiography using a team-based approach that includes cardiac sonographers and echocardiographers. Advanced non-invasive imaging training for categorical fellows includes exposure to transesophageal and fetal echocardiography, 3D echocardiography, strain imaging, and congenital cardiac CT and MRI. Our 2 cardiac operating rooms are located just around the corner from our 2 state-of-the-art cardiac interventional suites, which also includes a hybrid suite. The Cardiac Catheterization Lab performs over 600 hemodynamic and cutting-edge interventional cases per year, including transcatheter closure of septal defects, percutaneous valve implantation, hybrid procedures, and congenital heart disease interventions in the preterm infant. In the electrophysiology laboratory, fellows perform and interpret intracardiac electrophysiology studies and are exposed to intracardiac ablative therapies and pacemaker and ICD placement.
We are fortunate to attract talented and hardworking fellows who are deeply committed to providing the highest level of patient care and also embody a spirit of teamwork and altruism. Our fellows are unequivocally one of the strengths of our program.
I'm Deanie McVaden, and I'm a 4th-year Advanced Imaging Fellow at MUSC. I think I would recommend MUSC for pediatric cardiology training because I think the clinical experience we get here is unparalleled. I think we get a lot of autonomy, we see a lot of pathology, we get great mentorship from the faculty here. It's a great team to work for, and I am really happy with my training here and glad I came here for a fellowship.
Hey, I'm Trey Schwarzenberg. I'm a second-year categorical fellow. I think I didn't expect how much I would learn just in my first year. I really feel like I've grown a lot in my knowledge of cardiology just in 1 year, and I didn't quite expect to learn as much as I did. My co-fellows are fabulous. It's very much a team environment. If one person has a busy load, there's always someone willing to step up and help out.
My name is Stephanie Santana. I'm one of the fourth-year Advanced Imaging Pediatric Cardiology Fellows. The relationships that you build with all the different parts of the heart program here at MUSC, I think that we have amazing respiratory therapists. We create great relationships with our bedside nurses and our charge nurses, and you learn a lot from them. And of course our attendings, whether that's our step-down attendings, our ICU attendings, our echo attendings, and of course our surgeons. Being able to see all those different perspectives has made a tremendous impact in my education and for my future as well.
I'm Baron Bryant. I'm one of the third-year fellows here. Our caseload is busy. We have a very high volume and a very high acuity here in South Carolina. It's been a really good learning opportunity from that standpoint, just getting to see a wide variety, not only anatomy and physiology, but also of different cases throughout the state.
Hi, I'm Xander Hutchinson. I'm one of the third-year fellows here at MUSC. I certainly think that the strengths of the program are the responsibility that we as fellows are given by our attendings. They of course are there to always help us and to support us in every role, but really as we grow, that responsibility grows with us. And I think that it really prepares us to, when we go into whatever career pathway we go into, we're going to be really good general cardiologists, as well as if we decide to go into a subspecialty, we're really supported in that and can really make our pathway, and even to the point where we have funding here that if we want to stay for a fourth year in pretty much any subspecialty, and the program supports us in that. And I think that's an amazing piece of our program here.